Okay, so welcome back, everybody. Sorry that we're a little late. We're not going to have slides tonight. It's going to be kind of an informal discussion led by Judy and I, mainly Judy, talking about sorry, talking about the last week of the patient with advanced cancer treatment seminar that we just got back from Montreal about, because brought up a huge number of really important topics that I'm sure we'll learn a lot from and enjoy talking about. So let's see what I do here. Why it's not working. So do you want to get going, Judy, and kind of say what the seminar is about and why we go, and
Okay, sure. Jeff and I have been going to Montreal now for the past 12 years, of which I hadn't realized it was that long. We're studying with Dr. Andre Sain in Montreal, and he is the creator of the Materia Medica project. I'm not sure if any of you know what that is, but what he's doing, he has a group in Canada, a group in the United States, and a group in Germany that these people, each one individually researches through all the literature, the old literature, the new literature, whatever, um, looking for references to a remedy that they've been assigned. And these are remedies that are poorly described. And so that's how we got started. Initially, Andre did all the work, and then he realized he isn't that superhuman. So that's how the three groups got together. And I think Mac Rep or Synergy is going to have this as an available Materia Medica that you can purchase. So anyway, that's how we got started. And then it morphed into case analysis and management. And after the first 4 years of going through from acute to chronic to outrageously chronic disease, the last several years, he has been focusing on treating how to approach treating cancer. And he supports a lot of the things he recommends with the research in human medicine. And but the bottom line is that all his patients, if they are being treated with oncology, radiation, or whatever, he is treating them classically with homeopathy. And his basic tenet is to follow the organon. And if any of you have tons of money, he has an amazing course that goes through chapter by chapter of the organon. It's 500 hours. But anyway, so what happens is that he presents a case and doesn't tell us what remedy he's using. And we have to find the genius of the case and what supportive symptoms in totality to support our choice. And then he shows his choice. And then like this summer especially, he went into a lot of how do you assess your patient and in which direction it's going on. And he strongly suggests or tells you, he doesn't suggest, he tells you that cancer patients need to be monitored closely. And his patients go through a lot of lab work so he can evaluate what's happening not only clinically and how the person feels and everything, but also metabolically, what's happening at the cellular level. Um, and it's quite detailed. And he did mention that it can be expensive and not all of his patients can do it, but then he picks and chooses what's the most important thing. For us, a lot of the lab work is the research has been done on people, and we don't have much to go on with our pets. One of the parameters he looks at is vitamin D. And we do have a lab that evaluates vitamin D in our patients. I've been using it for several years now for anyone over 5, and I'm finding it quite interesting. You want me to go on with that, or do you want me to stop and?
Yep, why don't we see if there are any questions? And I just want to add, it's not that Andre is focusing just on lab work, he's looking at symptoms.
Right,
So
right.
what we're looking at symptoms, and but the difference or the rub being that he is looking at symptoms as externally observable symptoms or internally measurable or quantifiable symptoms. And yeah, like Judy said, if the patients really don't have insurance or can't afford the hundreds of dollars of monitoring, or if their insurance won't cover it, then he's totally fine just monitoring the externally visible symptoms the way most of us do. However, he did give at least 2 examples of cases that he was doing with advanced cancer where the patient was doing really well externally, but the internal symptoms were beginning to worsen. And that was his clue to change the posology
Yeah,
of the case. And
yeah, and it wasn't changing the remedy, because the remedy still fit, because the symptoms were still the same symptom picture. It was the same totality. And I think that's where his lab work is. We get subjective, especially with us, with the critters. Most of our symptoms, like is the dog better or the cat better or whatever, is the owner says, yeah, it's great. And then, or yeah, mentally it's doing wonderful. And then you see it walk into your office and it's like, holy crow, what's going on here? Oh, but this dog is so much better than it used to be. And so what Ann Hahnemann says, to hang your hat on more of the objective symptoms. So he is using the lab work pretty much to see if the symptoms that we're seeing, he's seeing, and what's going on that he can't see, if it's moving in the right direction. And that's pretty much what you just said.
The thing that's interesting, Judy, too, is also the kinds of lab work that he's ordering, and the times that I've heard him talk about this, is not your stuff that's necessarily measuring penultimate organ pathology. It's much more functional medicine assessment
Right.
things. Yeah.
exactly, yeah. He's using a lot of the research that has been done by a place called the Mederi Institute in Argonne, Mederi, if anyone wants to go there on the web and take a look. They've got a huge amount of resources, and they train conventional oncologists and holistic healers in the approach where, of course, their main focus is herbal. That's what they do mainly, is herbal supplements instead of, or in addition to, conventional chemo. He doesn't really use their supplements, or that many supplements in general, but he does use a lot of the information that they provide. And yeah, we have readily available the vitamin D. I did just call Antec, and they said, the other parameters that we don't commonly measure that he was measuring that he found very useful was the zinc and copper ratios. And we can get zinc and copper run. I don't know if IDEX runs them. Antec really just sends them out to the reference labs at LSU and a place in Utah. So I would imagine if they're sending it out, that it's slow and expensive. So probably, as Judy said, probably not that practical for us.
You're looking, to reiterate, Jeff, serum zinc and serum copper.
Correct. Thank you. Yeah. So
depending on the hair analysis lab you go to, that could be possible to extrapolate, but you'd have to fool with it a little bit.
yeah, and I'm not sure that any of them have really been, verified as far as the reference ranges. And I know they use a lot of hair analysis in functional medicine. I don't know how reliable it is for the animals. Do you guys, or does anyone here have any experience with, Great Smokies or any other lab that does the hair analysis routinely?
I've got some differential analysis results that were same sample, same day, taken to sent to two different labs, and got some really really amazingly divergent results just because of the way that they handle the hair when it gets there. And so I think for anybody who's thinking about doing those things, I'm happy to have a conversation with folks either by email or some other time. But one of the things that I've really found is that it really does seem to make a difference to the labs that you send it on. And I see this parallel stuff with some human stuff and also some animal stuff. But we happen to have a test that the client, I wasn't the primary veterinarian involved, but the client sent tests to lab A and then ended up sending them to lab B. They were taken exactly at the same time.
So Sue, in general, what's your assessment of the hair analysis?
I think it can be really useful. I think we need to look at how we interpret them as far as, is it bad or is it not bad that the stuff's in your hair? So I think the context makes a difference, and I think it's a window into a moment, and it seems to me that it's one of those things that needs periodic follow up so that we can determine what's happening from the functional medicine metabolic part of things, as bodies are making changes. It also makes a lot of difference of I've had some really interesting situations with false positives on stuff with people who worked in certain circumstances and had external contamination and those kinds of things. So there, I think it's pretty interesting. There's some really interesting work being done, like Peter Norwood in Australia is doing some really interesting work in all species, but humans and food animals predominantly, some and horses. That's quite interesting, and is it's got the Krebs cycle is pasted back up on my wall. He's really reductionist, like really reductionist and really micromanagementist, but I'm just thinking about accessible tools. I'd be really interested in hearing Judy's experiences doing more and more vitamin D testing, because my clinical experience is that really makes a difference. And we're seeing a lot of I mean, there's a huge body of evidence about the value of vitamin D. There's a huge body of evidence to suggest that there's a lot of deficiency. It's really widespread, and there's a huge body of evidence that says that stuff really changes after things are corrected.
Well, that's what I'm finding. And I think it also tells me sometimes when, if somebody I've tested, their vitamin D is good and then it tanks and nothing's really changed diet wise or anything, then I have to look like what else is going to happen. And what really brought this home was a couple of things. My Brian always he had IBD when he was a puppy, and I changed his diet, put him on remedies, and things went great. And so when the vitamin D came out, I decided to test it because I'm in this huge study, a 5-year study on vitamin D, and looking at the human literature about, if your vitamin D is in the appropriate range, inflammation goes down, cancer risks go down, type 2 diabetes risks go down. I mean, it's pretty amazing. And they have tons and tons of research in people. The lab, VDI, Veterinary Diagnostic Institute lab, runs vitamin D, and it's not expensive. It's really easy to do. And I'm recommending on every dog over 5. And the basic thing that, and I'm finding that the correlation is the same. What I've read and what they tell you is that animals that are spayed or neutered, older animals, animals on kibble, are more likely to have lower vitamin D levels. Animals with GI problems are more likely to have a lower vitamin D problem or value. And then you supplement it and you recheck it in about 3 months. I had one dog that did not respond well in 3 months, and we were retesting her now, and we're going to stretch it out to 4 months because it's like it's taking her longer to get up on the level, and we're going to see what's going on. With my Brian, who's on raw or was on raw, he was low, and in talking with the researcher, I said, but he's on grass fed, which is a big deal. If the meat is grass fed, that you use. And I said, he is. I see him. I see the meat down the road. But the problem is that it is low in fat, what he was getting. And vitamin D that our critters get is in the fat of the meat. So I supplemented him, and he did really well with it. And then I know every year I tested him once I got him stabilized. I noticed that his need skyrocketed, and he wasn't showing me anything different outwardly. And of course, he's my dog, so I do a bunch of tests, and they're all normal. And then within a few months, he started developing some symptoms. I think it was in a couple of months. And so it turned out that he had a thymoma. So this dog was brewing a cancerous tumor. I had no clue. I mean, I don't x-ray my dog every year or anything like that. He wasn't showing any symptoms. In fact, he was still competing. And but then things started falling apart, and I found the thymoma. So it was almost like in his case, if I had really thought about it, a bell to say that I should look further to see or to watch, just to watch if, and see if there's any changes. So I caught it early because of that, and his treatment was successful because of that. And so it really, really is worthwhile. And I think, sorry, Sorry about that, guys. So it is, it's affordable, it's easy to do. It's just some serum, you put it on disc. You can get it through Patterson, the little test books, and yeah, yeah, I recommend it for all of them. And I do find that kibble dogs are usually more deficient, and that raw fed, if they have fat in their meat, are normal. And I do see the values are at the lower end, but like my tech, she has 5 Jack Russells. She's always fed them raw. All of her dogs have been normal until this year with her 17-year-old who needs to be supplemented. But she's spayed and she's 17 years old. So.
Hmm. And what do you use, Judy, for supplementing vitamin D?
I've been using the RX folks just because of the size. Um, I know of some practitioners who say, "Oh yeah, I supplement with vitamin D, and I said, "Well, do you test?" And they say no, and they act like, well, they know how much these dogs and cats need. I got to tell you, I have dogs that have 100 IUs a day, and I have dogs that need 4,000 IUs a day. And vitamin D is toxic. And when I had Brian evaluated by a specialist, and I said he was on vitamin D, I thought they were going to have a heart attack. They started telling me how toxic it was and all that stuff, and I said, but I test him. And so I use the RX. They have 2 sizes. They have 100 IUs per drop, and they have 500 IUs per drop. And it's easy. It doesn't taste bad. I know because I tried it. And you just put it in their food. It's pretty straightforward.
Judy, are you um, I mean, I'm sure you are in your medical records, but I think this is really something that would be interesting to either talk to the academy or on a broader scope to talk to the AHVMA or the foundation to see if we can get a central data collection place so that we're gathering up just a repository, similar to the kind of things that we're trying to get started with glyphosate testing and AMPA testing, for example, so that we've got a central repository so that we can say, holy moly, you've tested however many tens or hundreds of dogs, and all of our colleagues across the country testing. So I think we would be able to generate a lot of data about that. I'm not aware that it's being done in an open source way. Do you know about that?
Well, the VDI lab they're researchers, so they've been publishing. I think they've published at least 3 articles in the last year.
Right.
On it, because they're the people doing it. So I don't know if when they send it in, they're also the group that does the inflammatory testing for cancer and stuff.
Right.
Which kind of plays into what Andre was saying, because he was talking about inflammatory markers, and so we do have a little bit available to us in a clinical sort of thing. And I know that like lymphoma and hemangiosarc are the 2 most inflammatory and pretty reliable through this testing. Brian's tumor was not, because of his history of IBD, and he's a golden retriever. I did it to him. Well, didn't do it to him. I took his blood every year and ran it, and he had really low inflammation. And this guy, Brian wasn't on anything, to lower inflammation. He wasn't even on omega-3s because he was picky. But when I talked to him about it, there are some tumors that are very slow growing that are not inflammatory, so it's not a good marker for it. But they've been doing a lot of publishing publishing of their data. And I know there are vendors at AHVMA.
Yeah, they
So
are.
so
Yeah,
you
and I talked to them last year and probably the year before, and we actually talked about some equine testing and other stuff as well, cattle as well.
Yeah, so they would have the data, of who's doing what, but they don't have who's sick or what, and they also recommend their testing for if an animal goes through chemo or if we have them do homeopathy, you can assess through testing if the animal is looking good and the people want to know, you know, and let's say chemo because that's the one. If you did chemo, the dog's doing great. You do a follow-up test. The test is normal, and then you test 2-3 months out, and it's still normal. And then you test another 3 months, and you notice things are changing. That would be an early marker for us as homeopaths. Um, I have some clients that would definitely do it. I have a lot of clients that would not. But if I have, let's say, things are going great with my prescribing and everything, and then things start changing, and I don't know is cancer doing something or what, I'm still going to prescribe for what I see, because I'm not going to prescribe on a test. I mean, there's no rubric for, oh, there's an inflammatory marker, I'm going to use this remedy. I mean, there just isn't. But it can tell you, again, what Andre was saying is posology, and if well, basically posology, because if the symptoms change, well, then you're going to change your remedy. But yeah, it could give you an indication. Because does anyone else have clients that want either A, diagnosis, or B, how is he doing other than you saying he's doing great, sort of thing? Like they want something more concrete.
I do. Probably three-quarters of them want to know what's going on and may not be very satisfied by my answer about what's going on internally, energetically, balance-wise. They want the name of the disease. They're often happy with that. So yes.
I think I talked to a lot of people who are really aware that vitamin D is getting a lot. I mean, it's getting an increasing play in the small animal veterinary world as well, but it's certainly getting a lot of play in the human side, and just that sort of extrapolation that, well, if this is the case for humans, and we've got a lot of information being generated out there about vitamin D and the usefulness, and so what about for animals, and a lot of people are interested in exploring those kinds of things, and looking at them.
Is there a way to see if the people who are on this webinar, how
Yep.
many do vitamin D testing?
We can just
Yep.
get them to
Yep.
raise their hands.
Yep. Just raise your hand if you would, if you do vitamin D testing, please. So Bianca said she does. Let's see. And Lisa said she does. Lisa Brennan said she does. And Bianca, and that's out of 9 people.
Okay.
And I don't do it either. Sue, do any of the farms use it? Jane just typed that she's going to start. And yeah, I would agree. Trudy.
They don't have a reliable test for food animals, horses or cattle at this point.
Yeah. Yeah. And the thing is, a lot of people, veterinarians too, because when I talk about this, and it's not like I'm lecturing, it's just that it comes up in conversation. cats and dogs do not get it from the sun. First of all, they have fur. Second of all, they get it through eating fat from the meat. And I don't think they get it from vegetable either. I think I know they don't. They have to get it through animal fat. So, and then again, if your clients are buying feedlot meat, you know, the fatty parts and stuff, they're not getting the vitamin D because those animals aren't grazing on grass. And, if you think about it, you get, the sun hits the grass, the herbivores eat the grass, they get the vitamin D through the grass, it goes into their fat. Humans eat the good stuff, they give the dogs all the bad stuff, the fatty stuff, and that's actually a good thing. Mice do the same thing, so it's just perfect synergy. And so it really does tell you, even if your client is eating, not your client, your patient is eating a homemade diet, you got to be a little aware of it. And I noticed when I look at bases, like some people make it from scratch and some people use bases. We sell a couple, but the three that my clients usually use is either Sojo, Dr. Harvey's, or Honest Kitchen, and they add vitamin D in there. And even though they're adding vitamin D, you still got to check because it may not be enough for your particular patient. The other little caveat is another lab that tests for vitamin D is my alma mater, Michigan State. And the reason they're doing it is because they had a problem with vitamin D toxicity in a commercial dog food. And there were some dogs died, some got really sick. The veterinarians are like, what the heck's going on? This is so weird. And they actually developed a test and found it in one of their labs. I don't know which one it was. And that was a while ago. That was a long time ago. So that made me really curious about vitamin D and very cautious about it because it can be lethal. And then when VDI started talking about it, and of course, our pets are always our guinea pigs. We tested the ones in our clinic and we had a pretty good range of it, and it really panned out, except for Brian, who his grass fed was not fatty. He was the only one that was outside the references that we were that I had been told. So of course it's my dog,
Now, regarding the reference range for D, Jean raised a question. She said that she was under the impression that vitamin D is safe in large doses and only toxic to dogs in ridiculously high doses.
Not that true. Let me see if I can.
I don't have the numbers, Judy, but I was doing some research with that, just looking at short to medium term supplementation in animals, and there was I have to think, I have to remember what species it was, though. I'm not sure that it wasn't for horses, but it was interesting. I mean, it was ProMed stuff, looking at relative toxicity, but it might be horses, so I'll just try and figure that before.
I'm going to pull up their range. Well, I know that in humans, the recommendation
Based on their reference ranges.
Yeah, they're different from their reference range is different from dogs and cats. The recommendation is dogs and cats to be between 150. And let's see. Elevated. So their range of measuring is from 0 to 200. And so 200 is elevated. That's 150 to 200, and they don't go above that. And I think since it's a fat soluble vitamin, and if you took an excessive amount all the time, I don't know really what the toxic dose was. I know that there was too much in that dog food for sure. I know that in humans, they consider a toxic dose over 200. That being said, the reference range for by our government is, and the medical profession is, if you are over 20, you're fine.
Which is way low.
Which is stupid, yeah, because it
Yeah.
means below that you're going to break. And
Mhm.
but the recommendation from the research is between 40 and 60. Going above that, there is not really beneficial. Like one of the studies I read about diabetes, they found that if you supplement in your vitamin D is around 40 to 50 even, your type 2 diabetes risk goes down like 50%. And if you are up by 60, it didn't make any difference. With that being said, and they are really worried about the toxicity of over 200. There is a Brazilian physician and researcher who is treating patients with MS. I mean, this is a sidebar. This isn't really important, but they are taking beyond extreme amount daily, and the other and it's helping their MS. But here are, challenged individuals who are sick, and they're under the doc doesn't say, here, take 200,000 IUs a day and I'll see you in a year. These people are under constant watch by this physician, and they seem to do quite well. When I started this study, my vitamin D was 31, and I supplemented, and I took it. My test was in April. And so I said, oh dear, this is bad. So I supplemented, which was recommended by my doctor and charts and everything. And in the fall, I was 115. So because I'm in the study, you fill out all these surveys. And then later I got this email like, what happened? Well, it was the summer. I was gardening, and I absorb my vitamin D really, really well. Other people don't absorb vitamin D really well. Just like our critters, if they have symbiosis or IBD or something wrong in their GI tract, they're not going to absorb it as easily as someone who doesn't have those issues. So it's a tad complicated, but it's not, horrible. But and the thing about, you'll hear people say, oh yeah, I take vitamin D 50,000 units a month, and it's all in a bolus. And the research is finding out that it doesn't work. It's not effective, and because it breaks down. So anyway, but that's in people. I don't know what it is in animals.
And Jane also was asking, she's curious about the 200 IU toxicity level that you were talking about. Is that in serum, or actually 200 IUs in the vitamin D that people are taking?
In humans, that the one case I was commenting on is a woman with MS. she was taking under this doctor's watch, it was 200,000 IUs she took orally every day, and her vitamin D level tested in blood was off the chart. They couldn't find, there was no value. She was just like screaming high. But again, because of all the side effects you can get from vitamin D, you know, like calcium deposits and all this other stuff, she was, and kidney issues and everything, she was pretty well watched. But she has MS. I mean, she's got this really nasty disease. But that's all I know about that particular patient, because it was a profile. It was profiled, so it wasn't from her doctor. It was her sharing her case. But that's in humans, so I don't know what it is in dogs. I never really looked up because I haven't had anyone that's super high yet. But if they were elevated, I would definitely drop them down.
Judy, I'm trying to get some references from PubMed. I was just doing a little quick search as you were talking, and I can, for some reason, send them to the panelists, but I can't send them to the whole group. So maybe Jeff can send them to the whole
Yep, I'm
to the
doing
whole
that
group.
right
Yeah,
now.
for some reason, my option to chat only goes to the panelists. PubMed has some interesting references. There's not a lot of them if you just search vitamin D supplementation and dogs. You know, there's only 32 articles about it, so it's not that hard to search.
Right. I think most of the public publications are probably more current too. I think I thought there was an older one that I looked at, but I can't remember what it
There's a
said.
2016 talking about, you know, the title of the paper is Oral Vitamin T Supplementation at 5 times the recommended allowance marginally affects serum 2,5-hydroxy D concentration in dogs. So it's just interesting to it's just interesting to look about how effective you know, the D source is and those kinds of things. Certainly, if you go off species, there's a lot more information.
Right, right. And I do think this is relatively new and for us. And the thing is that, as you know, when Hahnemann talks about in the Organon, he talks about you have to take in consideration environment, which he means, or hygiene, and he's talking about diet, exercise, the whole thing. And I think all of us, because of how we've been trained as homeopaths and stuff, is that we know that diet and environmental stresses and stuff are extremely important, not only to just general health, but also the how well the organism reacts to the remedy. Because if you have some severe deficiencies, you can have the spot on simillimum, and it's only going to do so far. And I bet all of us have cases where things are going pretty decent, and then you're stuck. It's just not going anywhere. And one of my thoughts is, is it something as simple as vitamin D supplementation? You know, will that kickstart my remedy again? And in the few cases where I've had that, where I'm testing it because the animal is ill and is under treatment, and I correct the vitamin D, it actually improves. And what I did see in one case, and it's only one, was we did that. You know, initially I changed the diet. I didn't test vitamin D until about 3-4 months later because I wanted to see what was there. We tested it. The dog was low. I supplemented it. I had already started treatment, and the dog it was a skin problem, and the dog was so-so, and had really made a big improvement, but then kind of like plateaued. And when I got the vitamin D back, it was low, and we supplemented. And 3 months later, we checked. But in the interim, by putting it on the vitamin D before I even checked it, I hadn't changed anything with my remedy, my posology, or anything. And the dog started getting better again. And when we checked the vitamin D in the 3 months, it was within the normal range. So we just left it there. And then we checked it a year later, and this dog is still doing good. And the dog does not have the skin problem, which were seasonal allergies, supposedly, a year later. So, I mean, that's only one case. So I can't, you can't hang your hat on that. But it kind of plays into this thing about environment and nutrition, and all that really plays a huge part in our health.
That was a huge part of the week was, talking about lifestyle, hygiene, diet,
Right.
and certainly, as Judy is saying, the monitoring of the vitamin D and monitoring of some other parameters that are also affected by the diet or supplements, and that was mainly again the cancer risk, or other chronic disease risk, in the copper levels in the body, and zinc levels, and counteracting copper versus zinc, and the role of mercury, and in our case it might be other environmental toxins, since actually, I guess mercury in most vaccines, I believe. Do all the vaccines, if they're not thimerosal free, have mercury in them? Yeah.
Yeah, I'm trying to think. There's a half dose core vaccine that was created for puppies and small white dogs. I can't remember the company now. And they said they took out extraneous proteins, but they didn't. I don't remember it saying it was thimerosal free. I'd have to go look. But my rabies vaccine is thimerosal free.
And Jean Dodds actually recently talked about that half-dose vaccine. She said she would avoid that because it's basically a concentrated version of routine vaccine, just half the quantity. Unless you're referring to a new vaccine, because that's been around for a little while.
Well, the one I'm using came out just 3-4 years ago, and we are not seeing the triggering of chronic disease like I did with even the recombinant ones. I mean, the Marielle recombinant vaccine, of core vaccine, I will never use ever again. I've had horrible trigger of chronic disease with that vaccine, and it's supposed to be safer. This one, I'm not having the problem. So I don't know.
Do you think that's the thimerosal, or you think it's the recombinant, the way they build the vaccine?
Well, we used Marielle before the recombinant, and we would have some issues, some triggering, but not as bad as what I saw with that. And that vaccine isn't complete. There's only one part. I think it's parvo or something. I can't remember now, but only one part of it was recombinant. And
So,
hmm.
so I'm just curious. I'm always curious when you guys go up to Andre's place. What's your holy moly amazing takeaway? Not to get us strayed back from this stuff, which is also part of the the takeaway, but if you had like the top thing or things that you came back with excited about from this year's session, what would they be?
I think it was a posology for me.
Yeah, that was number one, was the posology. I remember reading Richard had recommended Erastus cases, and I remember reading that he was giving in some cases a 50 amp potency, daily or multiple times a day to some of his patients, and I just couldn't wrap my head around that compared to what Richard was teaching us at the time of the Kentian dose and weight method. And that's pretty much what Andre has verified, is that if you find the simillimum, the holy moly that you say, Sue, is that we need to really be modifying our posology, the frequency of our dosing. And we certainly did talk about keeping the cancer patient under the influence of the remedy, but that can be a couple hours,
Right.
not a couple weeks or a couple days.
Because if you think of a cancer patient, the vital force is fragile, and it's crap, the word just flew out of my brain.
Well, it's totally disorganized and not
Yeah.
coherent.
That's exactly what I was looking for. It's disorganized. And we're trying to organize this this mess that's boinging around in this person, to try to get it calmed down, or not even calm down, but get it organized in a sense so it's moving in a curative path versus like scattered all over the place.
So posology would be number one for me, Sue, and I think Judy, as you said, it would be number one for you as well. What else? For me, I guess the second was what we just spoke about, which is the importance of monitoring internal symptoms, not just externally.
And
functional internal symptoms,
right? Functional, but and also just these cases. Well, of course, you're talking about. I think every case he presented was grade 4 metastatic cancer.
Yeah.
And so you're talking about if you delay something even for a short period of time, you could lose your patient. So his monitoring he monitors it quite closely.
Yeah.
And
and the result, the proof is in the pudding. I mean, had a huge glioblastoma patient, her oncologist gave her a couple of weeks to live, and I remember at the 1 and 2 year rechecks, he was just shaking his head every time he saw her alive. He said,
yeah.
I just don't understand.
And the tumor's gone according to MRIs and stuff like that, or CAT scans, whatever they use. But is she the one that was 10 years out?
I don't remember the follow-up. I don't know. I thought that was still an active case, but no, her daily rechecks are now once every 6 months.
Is the prescription still as relatively aggressive in those patients?
Meaning is
those long-term. I mean, he's got some really stunning cases of, as we've said, some serious deep-seated, hugely structural, ultimate pathology, chronic disease, and I'm really curious as I think more about this and work more with these is when we've got those guys that the textbooks say they should have been dead 10 years ago or 3 years ago or 2 years ago, that whole just looking at how bodies reorganize from that exceptional degree of pathology. And it's fascinating to me to watch how bodies reorganize from their pathology, and what do we have to do as clinicians to not have them out there flapping in the breeze as they learn to keep their legs underneath them. And I'm the obviously the follow-ups for this lady have been extended, and the I don't mean aggressive in a bad way prescribing, but watching that her body's able to hold a coherent thought insofar as response to remedies concerned. How everybody's different, obviously, but sort of how long do we see until bodies get congruent enough? Does he see in his cases till bodies get congruent enough to maintain in that face of that original?
I think it really depends on the individual.
Yeah.
That's the answer I come up with too.
Every case he gave had a different, not completely different, but duration of time. And there were, some of them were so like almost every hour dosing. And then as time went on, it was less frequent, less frequent, less frequent. I think they're all still are still being prescribed the remedy, or the remedy that fits at the time, which is usually I think all of them, well, as far as he went, they all pretty much are continuing on the main remedy that has worked so well. And it did show that if you had a life change or a stressor, like if somebody goes back to work or something like that, their posology, their frequency goes back up because of the stress and everything. And then what about the guy from Russia, Jeff?
The one that couldn't afford. No, he was a great one.
Right. He
do you remember which case that was? Was that lymphoma, metastatic lymphoma?
I think it was. But he was naughty. He just didn't do anything Andre told him to do. I mean, the man drinks, the man smokes, the man womanizes. His wife is pissed off at him and asking for a divorce. He can't do the blood work. And yet
he's making response.
Yeah, he was obese, and now he's lost weight, and I mean, and now he's seeing more women, and he's got metastatic lymphoma. But his posology wasn't as, I think probably when he was really sick, if I'm trying to remember, it was probably more frequent, but he was very erratic down the road.
Yeah, and then talk about erratic was the patient that was doing well on the remedy, and then her intuitive recommended Ruda.
Oh God!
She stopped Andre's remedy and started using Ruda, and people were like aghast that he was okay with this, but because she did backslide, but then she responded when they put her back on the chronic remedy. But he said, you've got to let them live their lives.
Right. Yeah. And he wouldn't have been like that a few years ago because,
no.
I mean, there were a lot of things that he said this year that we were in shock. And I really think a lot of it is because there's been some major personal changes in their family life, in their life. And it's made him less dogmatic, more human in his prescribing and understanding that life does happen. Because we asked, I mean, you're going to let an intuitive tell the patient, and we all get this, they talk to an animal communicator and they change your remedy on you. And And he basically said it just like Jeff said, this woman refers clients to me. She's been spot on in the past. And and he didn't say it, but I will say it. If you tell your client don't do what they say, they're not going to listen to you. They're going to listen to the intuitive. And then because if they don't listen, if they do listen to you and it goes south, it's going to be your fault no matter what. So I can understand where he did it, and the person did start relapsing, and he did say stop the ruta and let's continue with the remedy and see if you need it again. I don't think she restarted the ruta though again.
Nope, I don't think so either. Yep. So I know we're gonna have to go soon, but we did start a little late. Do you have a third as far as your take homes, your holy moly? Because for me, I think it was the lifestyle piece, because we spent a huge amount of time correlating, vitality and energy and mitochondria and
Mhm.
what you eat and how you live and how you increase your vitality and your lifestyle, and how that directly correlates with the development of cancers and many chronic diseases, serious diseases. And he gave a huge number of tips this year for things that you can do and eat to try and optimize that vitality and optimize the healing process. So what was your third, if you had a third?
I don't know if that was such a aha thing, because he's been talking about that for 12 years. And
Mm.
then and if you listen to his course, that is a major, even back then, because I bought the course when we first started, that was his big thing. What he does though over the years is that he keeps tweaking. Uh,
Mm.
one of the things that he was stressing was fasting. And which I know if I fasted my lab George,
Mm.
he would have eaten everything in my refrigerator because he could open it. So that wouldn't have worked. But I think my Patrick would have fasted if I did it. But I did fast my cats. I give them a bone, let them chew on a bone and
I
not
just
feed
read,
them.
I just read a really interesting article about fasting, sort of a philosophical article as well as metabolic, and talking about, when we talk about that individualization of the therapeutic intervention, that for some people, a fast for those individuals might be 6 hours. Um, and that can be useful as they move into it's if they never stop, just having that rest and reset even for 6 hours, even though there's some people that say, oh, physiologically that's not going to do that much and blah blah blah. They're actually finding that it does make a difference, and so if you could go 6 hours, the difference between free feeding and meal feeding, for example, can make a huge difference in a lot of animals, dogs and cats I'm thinking particularly.
Right. I don't recommend free feeding for cats and dogs. It's just, they don't do that in the wild. And second of all, if there is an issue where I need to feed them meals and they free feed, there's just too many questions
Right.
that I get. Um,
Yeah.
and it's interesting, the 18.6, we talked about, how many years ago was that, Jeff? 4 or 5?
4 or 5, eh?
Yeah, at least
Yeah,
5, or more and
yeah,
more.
Longer
yeah.
than that,
And
probably.
And
by 18.6, that's that was Andre's and other research determined hours of eating versus our fasting versus eating. That would do just what Sue just said, to
right.
it maximally without a prolonged fast. But many of us with other health issues will fast every day for 18 hours.
Right. And I just read a article, again, and it's about people, but they're even talking about 12-hour fast, you
Yep.
know, trying to get
Exactly
people
so.
to 12 hours. And I'm thinking,
Hmm.
12 hours?
Um,
I mean, I don't know how you eat more than, I got a screwy lifestyle, but I'm not sure how you can eat more than, well, so you
yeah.
sleep 8 hours and you eat from the time you get up until the time you go to bed, I suppose, is how that
Yep.
goes.
Yep. And then you skip breakfast, I guess.
Yeah, but that's if you're not fasting at all. Is that what they're referring to? You get up and you're eating and you go to bed and you stop eating as soon as you hit the pillow. I mean, I don't know anybody who does that. But if you think of a cat, well, not a cat, but a dog who grazes. There's cats who graze too. Um, I mean, herbivores are supposed to graze. I mean, that's their shtick. I mean, I'm not sure fasting a herbivore is. I don't know. I don't know about a herbivore. I mean, they're supposed to be constantly eating. That's the way they've been developed, but not cats and dogs or humans.
So before we go, there's still a bunch of people here. Anyone have any other questions? And while we wait, Jude, since lifestyle piece wasn't an aha for you, I'm wondering if you did have any other ahas.
No, I think those two were the two we discussed were the most.
Okay,
Can I ask a logistical question before we go?
Sure.
of course.
Is 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 anybody welcome to come up and take that course, or how does that work? Or is it only
Uh,
the guys that have been paddling in the canoe for however many years?
Health practitioner, so you can be an RN, you can be an MD, you can be an ND. There are a few lay people that I think they screw up, but
Sorry.
yeah, it's so I believe anyone's welcome, but you will have to get approved.
And getting approved isn't that difficult, especially if you're like a veterinary homeopath, like we are, and you show that you've studied. If you haven't studied, and this is where the lay people or physicians or nurses that have never studied homeopathy, they have an essentials requirement, and I think they used to have Lisa do a weekend, but now I think it's the essentials, which is 7 days.
Yep, yep.
And
That's an awesome course.
How big a
and
group is it, Judy?
was there 30 this year?
Yeah, well, it varies between 25 and 40.
Yeah.
I
When
believe this
we
year we had around that. Yeah,
yeah, when we started it was like 50, 60 people.
yeah.
So all the diehards. And we do have a group of young naturopaths who are coming now, who are really excited about homeopathy, and which is really cool to see the young people getting excited about it, especially since the naturopathic schools are um, dissing homeopathy.
Some of them, yeah.
Yeah, but any of us have gone through Richard's course would be able to come in and would be able to understand what's going on. You will definitely see a difference between the prescribing, but the philosophy, the organon is the same. And in fact, when years ago, a couple of physicians who do homeopathy, when Jeff and I were talking and stuff, they made comments about how we understood the organon, the philosophy a whole lot better than they did. And I attribute that to the course. I think probably our materia medica is weaker than theirs, but I think they were only focused on remedies and not on the nuts and bolts. So yeah. Yeah, come, please come.
So, yep. So Sue, did we answer that question?
Yes, thank you.
So, thank you all for coming. Speaking of the Materia Medica Pure project that Judy mentioned at the beginning, next month we'll have the leader, the head of the U.S. Materia Medica project, giving us his monograph of ferrum phosphoricum. So we'll be talking about a remedy that may be underused, as we're finding a lot of these remedies are underused. And then after that, Dr. Gregory Pace is going to be back. And so what will Gregory's topic be for August?
He's probably going to talk about failed cases. You know, how do you rescue those cases? A, how do you recognize they're failed, and B, how do you get them back on the tracks?
Great. So I hope that we see you all then, and have a good night. And Judy, thanks so much.
Yes, thanks, guys.
Thanks to everyone for coming.
You bet. Thanks, everybody.
All right. Bye-bye.
Okay. Bye-bye.